You've just finished a fast-paced session of pickleball. Quick lateral shuffles, explosive serves, and repeated lunges for that low dink. Your heart's still racing, your legs feel heavy, and your shoulders and hips may be tight. This is the precise moment when end-of-session recovery matters most. End-of-session recovery isn't optional. It's the intentional pause that helps your body transition from high activity back to rest, promoting tissue repair, reducing soreness, and preserving the durability you need to play week after week. At its core, recovery after play is about restoring balance. During a match or practice, muscles accumulate metabolic byproducts. Connective tissues experience microtrauma, and nervous system excitability is elevated. A 10-minute stretch and mobility routine targets these issues directly. It clears metabolic buildup through gentle movement, improves circulation to speed nutrient delivery and waste removal, and gradually downregulates the nervous system so you recover more quickly. For pickleball players who often play multiple times a week or enter tournaments, these 10 minutes are a high return investment in longevity and performance. Consider two common scenarios. First, a weekend tournament player who competes all day. Without post-match recovery, they wake up stiffer, slower, and more prone to compensatory movements that lead to injuries. A consistent 10-minute cool-down between matches preserves range of motion and reduces cumulative fatigue. Second, a recreational player who trains after work. Performing a short mobility sequence prevents shoulder and lower back tightness from becoming chronic, allowing them to maintain technique and enjoy the game for years. Many coaches and sports therapists endorse this practice. Physical therapists point to improved joint mechanics and reduced DOMs with regular cooldowns. Coaches note better practice quality the following day and fewer missed sessions due to niggling pain. However, some players dismiss cooldowns as unnecessary time wasters, especially after a casual game. The counterpoint is that skipping recovery increases the chance of developing overuse injuries and limits how often you can train effectively. End-of-session recovery connects directly to other aspects of pickleball performance. It supports injury prevention strategies, enhances mobility needed for low dinks and quick direction changes, and complements strength training by ensuring tissues adapt properly. In short, 10 minutes of focused stretching and mobility is a simple, practical step that protects your body, sharpens your movement, and keeps you playing your best. You've just stepped off the court, and your heart rate is still a little high, but your body is talking to you. That's what this quick assessment is about. Start by taking 3 deep, controlled breaths while standing tall. This shifts you from play mode to recovery mode and gives you a moment to notice how you feel. Scan from head to toe. Any sharp pains, lingering tightness, or joints that feel unusually unstable. Is one shoulder tighter than the other from serving, or is your dominant hip or calf feeling heavier? Note soreness that's localized and different from general fatigue. Sharp or severe pain is a red flag and may mean you should stop and seek professional advice. The purpose of this micro-assessment is twofold: to prioritize immediate needs for safe cool-down and to prevent small issues from becoming bigger ones. If you detect acute pain or a sudden change in range of motion, don't push through a stretch. Instead, apply basic first aid principles. Rest, ice if swelling, and seek help if necessary. For typical post-play symptoms like muscle tightness, minor joint stiffness, or mild imbalance, plan simple targeted stretches and mobility moves. For example, if your shoulder feels tight from overhead shots, include gentle doorway chest stretches and a cross-body shoulder holds. If your calves or hamstrings are cramping after quick lateral movements, prioritize standing calf stretches and a seated hamstring reach. If you notice lateral instability or stiff hips from constant side-to-side work, dedicate 30 to 60 seconds each to hip circles, figure 4 releases, and slow lateral lunges. Real-world players use this approach. Recreational players often stop for 5 minutes to address the worst offside before cooling down fully, while competitive players perform a short assessment to prevent niggles from accumulating over a tournament day. Physical therapists recommend this quick check as part of an immediate injury prevention routine, and coaches encourage athletes to communicate findings so subsequent practice can be adjusted. Possible pitfalls. An overly brief or superficial scan can miss early warning signs. Conversely, overreacting to normal muscle fatigue may lead to unnecessary worry. Balance awareness with reason. This quick assessment naturally connects to the rest of your end-of-session recovery. It informs which stretches, mobility drills, or recovery tools you'll choose next, making the 10-minute routine efficient and personalized to what your body actually needs. When you hear fundamentals, think of the invisible scaffolding that holds the whole recovery routine together. Breath, fluids, and just enough movement to tell your body it's shifting from play to repair. Start with breathing. Deep diaphragmatic breaths lower heart rate, reduce adrenaline, and increase oxygen delivery to fatigued muscles. Cue your voice to inhale slowly through the nose for 4 counts. Feel the belly expand, then exhale for 6 counts through the mouth. Repeat this pattern 3 to 5 times. Notice how the shoulders drop and the jaw unclenches. This isn't passive breath as an active tool to help clear metabolic byproducts like lactic acid and to prime the parasympathetic nervous system so recovery can happen. Hydration comes next because water is the carrier for nutrients and the medium for chemical reactions that rebuild tissue. After a high-energy sport like pickleball, you want to replace fluids and electrolytes lost through sweat. Sip room temperature water, aiming for 200 to 300 milliliters in the first 10 minutes. If you had a long session or felt heavy sweating, include a drink with sodium and potassium sports drink, coconut water, or a pinch of salt and a banana. Hydration supports joint lubrication, prevents cramping, and helps the kidneys clear waste products. It's not optional, it's foundational to feeling better the next day. Then move gently. The goal here is circulation, not conditioning. Begin with ankle circles and calf pumps to reestablish blood flow to the lower legs, critical after all those lateral bursts and quick sprints. Follow with slow hip swings and controlled leg hugs to ease tension in the glutes and hips. For the upper body, perform shoulder rolls and gentle thoracic rotations, keeping movements small and pain-free. Finish with slow, lumbar-friendly forward folds and side bends to lengthen spinal muscles. Hold each movement for 20 to 30 seconds, breathing steadily. Real-world examples. Professional coaches integrate these elements into cool-downs to speed return to play and reduce DOMs. Recreational players who prioritize post-match hydration and breath work report less stiffness the following day. Some therapists emphasize breath-first approaches to calm, nervous system-driven pain, while other trainers prioritize electrolyte replacement based on sweat rate testing. Challenges include players who skip cooldowns due to time pressure or underestimate fluid needs, and those who push into painful stretches instead of gentle mobility. Tie this back to your overall recovery plan. Breathing, hydration, and gentle movement are the triad that prepares your body for effective stretching, targeted mobility work, and faster, safer recovery between pickleball sessions. We're finishing strong, but recovery starts now. Upper body mobility is essential after a pickleball session. Your shoulders, wrists, and thoracic spine take repeated hits from serving, volleying, dinking, and overheads. Mobility here means restoring range of motion, reducing tension, and promoting healthy movement patterns so you play longer and with less pain. Start with the shoulders. Reach one arm across your chest and use the opposite hand to gently pull it closer, feeling the stretch across the rear shoulder and the back of the deltoid. Hold 20 to 30 seconds, then switch sides. This simple cross-body stretch helps release tight posterior shoulder muscles that get overworked during backhand and overhead strokes. Follow with doorway chest stretches. Place your forearm against a door frame at shoulder height. Step forward until you feel a comfortable opening across the front of the shoulder and chest. Hold 20 to 30 seconds on each side. These chest opening stretches counter the rounded forward posture that develops from repetitive reaching and lunging. Next, take care of your wrists. Begin with gentle wrist flexor stretches. Extend one arm with the palm up and use the other hand to pull the fingers down and back toward the forearm, holding 15 to 20 seconds. Then, flip the palm down and pull the fingers toward you for wrist extensors. Repeat both sides. Add slow wrist circles and prayer to reverse prayer movements to restore joint mobility and circulation. Strong, flexible wrists reduce strain during volleys, and help prevent common issues like tendinitis and carpal irritation. Move into thoracic spine work, because rotation through the mid-back is critical for powerful, safe swings. From a kneeling or seated position, adopt the thoracic rotation stretch. Place one hand behind your head, elbow wide, and rotate your upper body toward the raised elbow while keeping the hips stable. Hold for 10 to 15 seconds and repeat 6 to 8 times each side. Another effective drill is the open book. Lie on your side with knees bent, extend your top arm straight up, then rotate it across your body and open your chest to the ceiling, following the hand with your eyes. This promotes spinal mobility and improves shoulder mechanics. These stretches not only alleviate soreness immediately after play, but also build resilience over time. Potential challenges include pushing into pain. Mobility work should be controlled and within comfort. If you have existing injuries, modify intensity or consult a therapist. Consistently pairing these upper body stretches with the rest of your 10-minute routine supports smoother strokes, better posture, and fewer injuries, keeping you in the game longer.